In this video we will discuss about uh, in the cancer chemotherapy, what are the mechanism gets activated and in what ways it helps in decreasing the tumor cells within the patient. So let us start with the A panel that works on microtubules. So what it does in the uh, cancer cell is that microtubule, it prevents the aggregation and disaggregation of the both the process of the microtubules. So what happens because of this? Because of this, cancer cell division stops and it arrests the cells at that state, and also at the same time it altered the function of microtubules in such a way that it will lead to the death of the cells, as cells will not be able to perform its function for the survival. uh, the next thing the chemotherapy works on is on the nucleus section. So what happens in the nucleus section is in the cancer or the tumor uh, cells uh, and in its nucleus this this kind of agents, that is oxaliplatin, cisplatin, binds to the DNA of the cancerous tumor cells, and because of this it alters the transcription or translation, or you can say the central dogma, affects the central dogma of the cell, that is transcription and translation, and also promotes the apoptosis of the cancerous cells or the tumor cells. So in this way the cancer cells will also degrade within the host. And the third part is talks about third part by which this chemotherapy works is on the mitochondrial part. So as we know that mitochondria is considered as powerhouse of the cells, so it is important to disrupt the powerhouse of the cancerous cells. So this four reagent that works in the same almost the similar way, that is oxaliplatin, cisplatin, vincristine, paclitaxel. So what it does is they interfere in the mitochondrial DNA that leads to altered mitochondrial function, and ultimately what is the ultimately the result of this might lead result of this will lead to activation of apoptosis. Apoptosis is considered as program cell death, and this is the third section by which the chemotherapy works. The last section is about the activation of immune cells. So it is essential that uh, any it is essential and beneficial to activate the inherent or innate immune system of the body, so that it can perform it can continue to perform and work against the tumor cells uh, that are present in the host. So it works here. There are some of the sections of the immune system are shown on which the chemotherapy acts upon, such as macrophages, T cells, and monocytes. So they chemotherapy works to increase or to release the pro-inflammatory cytokines, and we have understand in most of our in some of our previous videos related to immune system and cancer, that the release of cytokines will lead to activation of B cells, and that activates the T cells. Sorry, release of the cytokines lead to activation of T cells, and then that leads to activation of B cells. And we know that T cells is considered as the first response, and B cells activate later on. So because of the activation of these cytokines, uh, the T cells and B cells get activated, and these T cells can and then recognize the or are trained recognize or trained against the tumor with the antigen present on the cancerous or tumor cells. And as soon as they identify any cancerous or tumor cells that have that antigen, it can initiate its immune function, such as initiate apoptosis in the tumor cells, or the program, or initiate the program that within the cancerous cells. So in all the one common thing about all this mechanism is that it will degrade the tumor within the host by initiating the death of the tumor. In no way, in all of this four way will not work towards uh, curing or treating the tumor cells and bring it to the normal cells. All of them works towards uh, either initiating apoptosis or uh, uh, degrade the tumor cells by other mechanism. That's all for this video. Thank you for your time.